Hello everybody, welcome to the Custom Body video clip today. Today we have a special guest and he's gonna teach us about shoulder pain. Sometimes our superficial pains, they can be adjusted just by strengthening and give some flexibility to your muscles. Very simple, but sometimes there are some pains they can be that simple. And he's a professional like my friend Dr. Ken, Albrecht. They can help you with those problems. Also, before thinking about surgery, this could be another option for you to actually fix that shoulder pain. Once again, this is great information, so let's get straight to it, okay? Dr. Ken, welcome.
Thank you.
It's great having you here.
Thank you for the opportunity.
Oh, it is my pleasure. I want people to actually learn more about their shoulder problems and get some information about how they can avoid that pain, or how can they fix it once they have it, where the problem is coming from, etc. So talk to us a little bit about that.
Okay. Well, what I'm going to cover today is 4 basic components that I've found over 33 years of clinical experience and having several various clinics with sports injuries and auto injuries and this kind of thing. And what we found is that the underlying cause of repetitive or chronic shoulder problems that are of a non-surgical nature, and I'm talking about where it's not in the emergency room, there's no question that there's a dislocation or something surgically wrong, but it's just that annoying, moderate to low grade shoulder difficulty, range of motion, or pain when you do certain activities, but not all the time or not necessarily constant. Those are the type of problems that can really be helped with the components that I'm going to cover.
Okay, perfect. And why people can get those shoulder pain?
Well, there's 2 main factors. Number 1 is gravity.
Okay.
We all have to stand up and fight gravity. Now, we don't think about that consciously, but the reality is when you die, you hit the ground.
Okay.
So, to keep that in proper perspective, you're spending your entire day on your feet, up and around, fighting gravity to stand up. So, posture becomes a number 1 component.
And that's why it's important probably to exercise and keep that posture all the time.
Yeah. And in your arena, and Sandro's probably a lot more of an expert relevant to shoulder issues than you're giving yourself credit, because the major component of a shoulder problem is the fact that it's the number 1 dislocated or injured joint in the body, because it's a ball in a socket. So the arm bone, the humerus, is basically just sitting up there with a ball on the end of it in this socket, held together by the tendon and ligament attachments in that shoulder joint. Not a lot of strength and control in the anatomy of the bone structure itself, just kind of hanging there.
It's the muscle who's actually holding down.
Sure. And then what we found is, okay, well, why do the muscles, even though they may have proper strength and position and function, still causing a chronic problem or pain? So then we move past where it's a muscular issue, which you can certainly help with, no question, just in proper strength, positioning, range of motion, etc., into the anatomy of the problem, and that's what we found. So the components are basically pretty easy to understand when we look at it in terms of how the body is constructed anatomically to support the shoulder girdle, as we'll just refer to it, the whole arena of the shoulder joint.
Perfect.
And there's 4 components, the first one being simply that it's the neck area, which number 2 would lead into the upper back area.
We're talking about the spine, right?
Yeah, this would be this is plastic, not a real person. This is a replica, of course, of what the spine would look like.
Okay.
The head would be up here, the weight of your head, the neck area, upper back area, lower back, etc. What's interesting about this, number 1, as a starting point, is that God created the spine to resist gravity. And the way He did that was pretty interesting. And when I say He, I don't mean,
He or he or whatever, right?
So, yes, the creator, okay? So, the neck has a backward curve. The mid-back goes the opposite direction. I'm over-exaggerating it. And the lower back, of course, curves back again with the pelvis. So, we have these curves that are created. And what's interesting is if you put a ball here, and a ball here, and a ball here, you'd see the 30-degree angles. So it's not by a circumstance that it just kind of happened that way. This was constructed with a lot of wisdom, because those angles allows maximum resistance against gravity. Now when we deviate our posture, which can either be from laziness or lack of muscle strength and tone and balance, which is your arena, you can create your own problem over time. Let's just take the example of the person who ever since childhood just slouches all the time. They slouch sitting, they slouch standing, they let their head fall forward, all these problems. That can only go on for so long until you're almost stuck in that position. You created it.
Because that's when you actually don't keep your spine in line. That's when you start, those angles are not the way it's supposed to be.
That's right.
And you put in a lot of stress because of gravity.
That's right.
Right? And that's when the shoulder pains begin?
Yeah. And this
okay.
and here's why the component is. And the simplest way, I'm going to have you hold that just a second. If we take this 10-pound ball, which represents the average weight of a woman's head,
okay.
A little heavier for men, 10 to 12-pound range,
okay.
varies. And if I'll let people at home show this example, hold the ball in your hand backwards to represent the backward curve of the neck, holding the weight of the head. What they found in research was that you will take the weight of the head, which is 10 pounds, on a normal position of the spine, and as soon as you straighten that out or let it fall forward, that weight can go to 30 pounds.
I see.
Now, what supports that? The muscles from your neck, base of your skull, down the neck, out to the shoulder joint, that's holding that weight all day. Now you can kind of see the relationship structurally and functionally how posture plays such a role.
So, what are you trying to tell me? Let me know if I misunderstood this.
Mm-hmm.
Well, once you tilt that bone a little bit forward, you're holding more weight on the side, which
sure.
the spine is not made to actually hold.
No.
You need to set that bone right on top of the bone, right?
That's right.
To have more strength and not
Yep.
straining the spine.
Sure.
And that pulls your shoulders?
Well, what happens is, and we'll go over the upper back, the other components, but in the big picture of things, yes, as soon as you start throwing that forward, everything tends around forward. And a lot of people have you probably noticed, a lot of strength in the anterior musculature and very weak in like the rhomboids, latissimus dorsi, some of the other muscle factors, the rotator cuff group.
So what we talking
in the back. So
yeah.
You're trying to get them to strengthen the extensors as much as the flexors to have proper balance.
Yes.
Most people are naturally tighter and stronger in the front region and weak in the back.
Yeah,
and I'm sure you see that.
Yes, completely agree with you.
So when you work with a client to strengthen that, and they respond really well, and even their shoulder function is much better and less pain and symptoms, that's where it's just a muscular postural issue.
So let's go to the other point, which is when people actually have the right posture, but they have some accidents.
Yeah. Okay. What can happen there then is the detail of the individual joint position and function that can create a problem. So for example, the person with the proper posture, and anybody, and I'm sure you probably have posture charts around, but you know, where the ears over the shoulder joint and etc. Proper posture but still shoulder issues. Now we're talking about the other components. And what happens is, for example, if you get into a situation where the inside of your spine, the neck is in a forward bent position from an injury to a couple of particular joints, such as a whiplash injury, a snow skiing injury, multiple micro injuries over time.
Get hit when you are stopping.
It can be 5 miles an hour at a stop sign. No big deal. You don't even think about it. But here's the example I want you to think about that makes sense. If you think of the logic of it. It was maybe a mild injury as you see it, because there's no blood, no guts, no broken bones, so I walked away, no big deal. But if you hit your brand new car on a curb, potholes, railroad tracks, you eventually knock the alignment out of the front end of your car.
And that's when the tires
and your tires start to wear uneven.
So that's the same thing that happens to the
same,
body. And you actually commented to me before that it heals in the wrong way.
You'll always heal. So here's again where sometimes patients misunderstand what micro-traumas to joints do internally to the body. Micro-traumas repeatedly over time can end up being a major trauma to the joint.
Because it heals in the wrong way.
Right. Because you're going to heal, but you're healing dysfunctionally.
And that's when you enter into...
Right.
Into
so diagnostically speaking, you know, when you have that case with the repetitive shoulder strain, the chronic shoulder issue, even after everything you've done with working out and it's still a problem, now you have to diagnose what's the component.
So let's talk real quick about once it's done. And let's say I want to go to a chiropractor. What should I be looking for? How I know that that chiropractor is going to help me?
Well, there's a couple of things, and the first component would be, more than anything else, is that the doctor's sitting down and walking through your personal history, spending some time to really walk through the details of what got you to where you're now complaining.
Okay.
You know, if you don't walk through the history, and I only say that because you don't want to, you know, any doctor, MD, my stomach hurts, take these blue pills. Well, he should walk through when did you know, a little detail.
A little detail.
So
Tell me
detail
about the
of
steps.
history.
Tell me about the step. What step do you follow? Well, let's say I come to you and my neck hurts.
Following the consultation and history of detail, how you got there, and even old stuff, because micro-traumas in the past, then I do a physical examination. And the examination with all chiropractic, you know, is a proper orthopedic workup, neurological workup, range of motions, muscle strength, etc.
Okay,
so,
can you talk to me in English?
Oh, I'm sorry. Basic physical exam of what's normal and abnormal to number one, rule that you are a good candidate for chiropractic care, not a referral for potential surgery.
So what's that assessment? How do you do it? You just move my head?
There's physical,
X-rays?
yes, there's physical tests performed that would be the same, actually. The tests are no different than what an orthopedic surgeon would perform if he's examining you for shoulder injury.
So you do the same
test. We take
and
the same medical training.
The test is
sure.
X-rays.
Well, X-rays is the next component, and again, X-rays aren't always necessary in every patient case, especially when it's really simple.
Okay.
But usually in a repetitive problem or a chronic problem, X-rays are going to tell a lot of the story that's misdiagnosed by guessing. When you see the X-rays, you see all the detail.
And
so X-ray films are extremely valuable because you see normal positioning to what abnormal would be internally that you just can't see with the naked eye. Like a dentist looking at your teeth structure.
They need to go
to find out what's underlying. Okay.
So now tell me a little bit about.
So the first component is the neck position. The second, that leads to the second component, because we already briefly described normal backward curve positioning and weight of the head on top of the neck and shoulder muscles and everything. Well, that leads into a lot of people with a forward head posturing from an old trauma or injury or really bad posture. Now they're getting into the upper dorsal spine curvature problem. Now that's called a kyphosis, and that creates a problem, and you'll understand in just 1 minute why. Because as you throw everything forward, and if you curve your spine forward, and let this curve right here be excessive forward with your head falling forward, you're going to start having problems with the shoulder range of motion right away.
Okay. So
and I can show you that in a real quick example.
So that's in the spine.
Yeah.
That's what we were talking about with the ball.
Right.
Okay.
So that's the second component, which is the upper back arena of the bone positioning of the vertebra, locking in the rib cage, scapula and clavicle, all affecting shoulder motion. So now you're restricting shoulder motion, but still using the shoulder. You're still out there shoveling snow every day.
So that's when you have that pain because
right.
I
shovel snow and I can't sleep on my shoulder.
And even though, that's when I need an adjustment, you think? Not one adjustment,
sure.
but a series of adjustments to be able to fix that imbalance.
Sure, possibly,
right?
And again, that's based upon how the exam shows and the x-rays may show.
And that's when you go into the test and show a person what that person needs to, what treatment that person needs to actually fix that, right?
Because there's a quick third and fourth component that comes in this whole shoulder girdle. You know, we talk briefly neck, we talk upper back curvature too much, throwing everything forward. Now the scapula, which is your shoulder blade, huge involvement in shoulder function and many times overlooked in therapies.
Now, tell me a little bit, I see that you have a lot of knowledge. You're going into a lot of details into all those muscle components, and you actually told me why people get injured. Where do you get your knowledge? Tell me a little bit about your study.
Well, real briefly, because most people don't understand, the actual hours of education in chiropractic college actually exceeds what's in medical college for education. We spend just the same we use the same textbooks. Half of my faculty in my chiropractic college were medical doctors teaching us anatomy, physiology, pathology, etc., etc., etc. So the education to chiropractors, which most people just didn't understand, is actually the same length of time as going to medical school. It's just we chose not to do drugs and surgery, but our treatment goes towards natural.
It's just simply like a holistic doctor. You have to go through the same thing, but one is just don't use drugs, and the other one
it's just a choice. It's a philosophical choice. It's
Perfect.
like somebody out there saying, I choose to eat organic, or I'm just going to eat whatever they throw at me. You know, so
in other words, it's a smart decision.
Sure.
Thank you so much. We have some information about the shoulder. Now we know why we have some shoulder pains and how we can fix it, and also how we can avoid that real quick by strengthening and stretching your muscles at the same time. Or if it's traumatic, you actually need to be aligned. And don't forget to go through all the tests to be able to actually be aligned and see what areas of I'm trying to think about the word, but I get it here in my head. The treatment. Thank you so much. Of the treatment, you need to go through it. Keep following us. We're going to be doing a video once a month. My friend Dr. Ken will be in another video again. Probably going to be talking about other issues. Thank you so much. Really appreciate it. Please share this video, comment, and subscribe to our channel. You're going to continue getting a lot of information. Remember, we're doing this for your health. We want you to stay healthy. We want you to live a happy life, and we want you to just enjoy life in general. Thank you so much. Looking forward to seeing you next. Dr. Ken, thank you so much for your time. I really appreciate it.
Thank you.
And we'll see you next time.
It's great having an opportunity to be chiropractical.
Nice.